Thank you so much. Can you hear me?
Loud and clear. Everything's good.
Very good. Thank you so much. And thank you so much for this opportunity to present the experience from the regional office for the Eastern Mediterranean, but also to highlight that this is an initiative that has been running on for quite some time. And it really came in collaboration with UNICEF, with IFRC, and most importantly, with the interagency working group that we have put at the beginning of the pandemic and currently run by the three organizations. So if you can move to the next slide, just I mean, a little bit of a background on why we have started with this initiative to strengthen social listening and community feedback. I think as most of you or all of you know that there has been, or at the moment, there are a lot of mechanisms going on in countries with their social listening or community feedback. The understanding of those mechanisms is not really clear to everybody who is working in this area of work. The region is not different from the whole world in terms of the challenges related to infodemic, but also the most important thing is that we mostly lack the real-time information in order to inform the response to the pandemic or other health emergencies. And therefore, WHO, in collaboration with two different organizations, UNICEF and IFRC, but again, with the collaboration of the interagency working group, we decided that we need to look into this issue from evidence-based, but at the same time, to make sure, practically speaking, we understand what's going on on the ground and how we can put together a mechanism that would serve the whole region. So we started with this initiative back in February, basically 2 or 3 months back. And if you move to the next slide, one of the most important things that we discovered during this this initiative is that the understanding related to social listening and community feedback is not really consistent. Some organizations, they're having social listening mechanisms or tools on the ground, others they're having community feedback mechanisms on the ground. With the difference in the definition of both mechanisms, it's really very difficult to draw a line between both of them. But the most important thing is that both of them, they can provide community insights. And the most important thing, and this is what we are aiming for, is really to have a systematic approach in countries where these community insights can be captured, reviewed, analyzed, and inform decisions whether to manage infodemic or to add this in a bigger picture, the risk communication, but of course as an integral part of the response to COVID or other health emergencies in the future. Thanks for moving to the next slide. So this initiative included 6 steps. So the first one is really to make sure that we have a unified understanding when it comes to social listening and community feedback, and that came very clear after we had the first meeting with the different organizations to clarify the definitions and what is the main purpose behind social listening and community feedback. We recruited a main consultant who has been leading this work, but also the colleague has been supported by a number of colleagues from WHO and from UNICEF and from IFRC in order to be able to run the process. And of course, a lot of support was given by the country offices to facilitate the whole process. We conducted the assessment. After that, we convened capacity building workshops, basically focusing on the main players in this area of work to make sure that we are all on the same page. And we are at the moment in the process of developing an operational model and a roadmap that will be coming out after conducting an expert consultation that will be looking into the recommendations that I will take you through at the end of this presentation. If you move to the next slide, thank you. So basically the assessment that we have conducted, it included 3 steps. The first one is this review, and for this we basically looked into different guiding documents and tools, the strategic framework that EMRO has put in place, but also different examples for the social listening and community feedback that we have captured, but also we have been reading about. We also conducted an online survey, and this was a designed survey to better understand the ongoing efforts, successes and challenges. And at the same time, we also conducted key informant interviews with selected experts at the country and regional level. And the most important thing that these interviews basically help us to understand what were the enabling factors and barriers for systematic listening, and which was our ultimate goal to reach after that. If you move to the next slide, for the online survey, basically we had responses of 41 coming from 19 countries. whether country offices or ministry officials or different organizations. And those responses basically were coming from different representatives at the country and regional level. We have used the Kobo toolbox, and that survey was opened during the period of 24 February until 18 of March. Next slide, please. The key informant interviews were conducted, and we managed to conduct 46 interviews. These included 77 persons, and these were coming from 17 countries, from different organizations, as you can see on the right side of this slide. But also the regional office for EMRO, Afro, and Asia Pacific. At the same time, we had also interviews with colleagues at HQ, just to make sure that we are harmonized and aligned when it comes to the overall process and how we're going to move forward. If you move to the next slide, I will take you quickly on the main findings of these. I'm sorry for that. I'll take you through the main. Can you hear me? Yeah. Main findings of this assessment. So the first slide is basically on the main challenges. So reaching to the most vulnerable population has been identified as the main challenge, and therefore there has been a call to use the offline engagement, because the online one would be sometimes mostly difficult due to the lack of connection to social media. A lack of coordination between the different players on the ground, and therefore the roles and responsibilities were not clear. How to make sure that we're focusing on the broader picture and not only focusing in a haphazard way or only on limited activities. Data analysis was major area of a challenge. In a way, this needed a lot of improvement, and the work with the government has been additionally challenged in a way that the mistrust that has been observed in some of the countries also had added to these many challenges. If you move to the next slide on the main barriers, insufficient capacity, whether technical or human resources, political sensitivity, in a way that some of the countries we observed that governments were not really promoting the open communication, and therefore making sure that we have really a system in place would be pretty much challenging. Again, as I said, with the lack of coordination, there has been a lot of duplicating efforts. There has been a lot of competition, lack of sharing of community insights between the different organizations that are dealing with this area of work. Of course, there is no systematic approach, and the barrier related to language also has been coming out as a major barrier, particularly that most of the organizations that are serving on the ground, they're basically using the English language when it comes to the social listening and community feedback, even with the material that are being produced. Of course, there are some efforts to translate those material or these efforts into the local language, but this is still considered as a barrier that needs some work. If you move to the next slide with the main successes, in few countries, we have observed a good relationship between NGOs or local NGOs and the government, and this really facilitated the work, making sure that we are working with the community directly through local volunteers or community leaders. The availability of data really highlighted some of the important challenges that communities are going through and really informed decisions. And therefore, this has been observed in very few countries where the information was available. The sharing of insights has also been identified as a main success, and using the different platforms, whether they're at the regional level or at the country level, to share those insights and to act accordingly. If you move to the next slide on the main enablers, and again, as main findings from this assessment, the experience prior to COVID has been a main enabler, and particularly if we talk about the polio and how community engagement has been a major area of work if you want to facilitate reaching goals related to the polio program, and therefore building on these efforts could be used as could be observed or could be perceived as an enabler to the systematic listening. Sufficient human resources have been seen in very few countries, and we consider these sufficient human resources as a main enabler to facilitate this area of work. Of course, the availability of tools and guidance, and at the moment we have to build on the momentum related to vaccine. We have a lot of challenges, but also we have a lot of successes that we can build on, and therefore this can be considered as the main, if you want, turning point where we can really invest more when it comes to social listening and community feedback. Next slide, please.
9 minutes.
Thank you. When it comes to the capacity building, we so far managed to conduct a series of workshops that included many players on the ground. And at the moment, we are finalizing the package to have a ready-to-go package that can be used by the different countries, by the different organizations, in order to make sure that we have a systematic way of building the capacity of the human resources. And if you move to the next slide, which is the last one, these are the key recommendations that came out from this assessment. One is that we want to strengthen and clarify the role of the different organizations, and this will help in increasing coordination. To build capacity of human resources in so many different ways, as you can see in this slide. And not only to invest in human resources, but also technically speaking, we need to work a lot in building the capacity in the different areas, and mainly data analysis and the use of data and the triangulation of the data that will be coming from the social listening and community feedback with the other elements, whether EP, whether social measures, in order to be able to capture the full picture. It's very important that we always localize the support to communities, and of course, to make sure that we have standard operating procedures for the systematic approach. And if you allow me to conclude my presentation by commending our colleagues in HQ for having the EARS platform, which we considered as a very important platform that would facilitate a systematic approach of social listening and community feedback. With the support of our colleagues from HQ, we're managing to expand this platform in 5 countries. And really the idea is to expand it in the other countries in the region. But the most important thing is that we're using 5 countries where there is no system at the moment. And in the future, we want to make sure that there is a very standard way of doing the social listening and the community feedback, and making sure that the different systems run by the different organizations are really aligned. And most importantly, they're saving the collection and analysis of community insights. And this will help in informing decisions and moving forward. And thank you so much for listening to me.
Dalia, thank you very much for this summary. I think really the learnings and the recommendations that you presented, they're really rolling over into a social listening system. And not just, in building capacities for the response, but then, this is something that can really look at strengthening the systems, both with the health authorities, but also partners in how to institutionalize. So I really appreciate the recommendations that you summarized. I'm quite sure there will be lots of discussion on this. Thank you very much.